Okay, Davina,
Okay.
take one. So we're gonna do lower airway obstruction,
Okay.
and this is gonna be our child patient.
Okay.
And you're working in the emergency room and are asked to see a 20-month-old infant sent to the ED by the primary care physician because of difficulty breathing. So she's looking at you. So is she
Okay.
conscious?
Okay. Is she? Oh. Is she alert?
She's looking at you.
She's looking at me.
She seems very anxious.
She looks anxious. What's her rate of breathing?
Her rate is she's tachypnic,
Okay.
and then she has no sinusitis at this time.
Okay. Cat refill is good.
2 seconds at the moment.
Okay. Okay.
Put her on
Let's
the
put her
monitor.
on the monitor.
Her pulse oximetry on room air is 96%
Okay,
at the
we got her
time
on
being.
pulse ox. We got her on the leads.
And you notice she has retraction, so is that failure or distress?
Distress.
And so you're listening to her lungs
Okay.
with your stethoscopes, and on both sides you hear bilateral inspiratory, expiratory wheezes.
Okay. Inspiratory, expiratory reasons.
And then you check her temperature, and her temp is 100.3.
Okay. Can we also get a glucose check on her?
Very good choice,
Okay.
and her blood glucose is within normal range.
Okay. So we may consider doing a NEP treatment.
Yeah, so we're gonna give her NEB treatment. So you can get one of those combination masks. So because she's probably not gonna want the peace pipe, but you can connect the breathing treatment down there.
Okay.
So she's being nebulized. She probably has lung inflammation. So what else do you want to consider for the lung inflammation?
Some steroids, maybe dexamethasone.
Sure, that's perfect.
Maybe get a new set of vitals on her.
Her heart rate is tachycardic for a 20-month-old.
Okay.
She has no known allergies. We know she has respiratory distress. She has no past medical history.
Okay.
She just ate juice 2 hours ago. Her blood glucose was fine.
Okay.
Her urinary output has been fine according to the parents in the diaper change.
Okay.
And just her lungs, she's just wheezy, and she's getting the corticosteroids and
NEP treatment.
the nebulizer.
Okay.
And she's visually tracking her parents. She's a
Okay.
bit fussy,
Okay.
so you've treated her appropriately.
Okay.
So we'll start off on something different. So let me see Broslow, whatever I did with it. I'm getting paper inundated. Oh, it's right here.
Yep.
So show me how you would measure it.
Okay, so it's a marker measure from this end. So we go laying the patient flat.
And let's just say her heel or her foot's down here.
Okay. Alright. So she's in the yellow.
Yeah, and so that correlates to how much weight.
This is anywhere between 12 kilos and 14 kilos.
Okay, so just leave it there.
Okay.
This is in the urgent care. We're notified that our paramedics are en route with a 12-year-old child who has had several days of vomiting,
Okay.
diarrhea, poor oral intake. Paramedics start her on low O2 because of a decreased O2 saturation. No IV is present at this time. She's here, you're assessing, she's visually tracking you.
Okay.
She's really lethargic though.
Okay.
Anything you want to check on her?
Airway is pained. Breathing depth, good depth, chest rise, rate of
Yeah.
her breathing is okay. Her circulation, cat refill.
Well, you check her blood pressure.
Mhm.
It seems appropriate for the age,
Okay.
but the capillary refill is sluggish.
Okay. So we.
And she's had vomiting and diarrhea, so what kind of What do you
I
think?
have shock, hypovolemic shock.
And based on her blood pressure being normal and a sluggish capillary refill, what do you think? What kind of shock?
Hypovolemic.
But her blood pressure is normal.
Blood pressure is normal, so she's perfusing okay.
But her cap refill is
Is sluggish. Oh my gosh.
compensated.
Is compensated.
So she's on a monitor, she's sinus tachy. Wherever it is on here. Okay. We'll just say sinus tack for the
Okay.
age.
Okay.
She's 20 months old. She has no known allergies, no medical history. So, what if she had a low blood pressure and
Okay.
sluggish capillary refill? What kind of shock is that?
Probably decompensated shock.
It's the reverse of what we talked about.
Okay.
So, good blood pressure
Okay.
and sluggish capillary refill, that's compensated shock.
Okay.
When you have bad blood pressure
Tanking. Okay.
and weak thready pulses, what kind of shock you think? She's had vomiting and diarrhea.
So it would be hypovolemic shock.
Perfect. So she's hypovolemic. She's 20 kilos. So her blood sugar, you just checked it,
Okay.
and it's 20.
Okay, so we would consider giving her D25.
So that's given. Her stats on nasal cannula are changing to a lower percentage, like 90.
Okay, so we would put her on supplemental oxygen.
And based on the fact this is no trauma relation, she's had vomiting, diarrhea, poor feeding for several days. So she's gonna need,
Maybe some fluids, some fluid bolus.
and she weighs, let's just say 14 kilos, so
Okay.
20 times 240.
Okay.
20 times 40, so,
That's 800.
I mean, wait, how much did I say?
14 kilos.
14 kilos, not 40
kilos
kilos.
and 20.
So like 360-ish.
Okay.
So we're gonna
Okay.
fluid bolus her.
Okay.
Her glucose now is
Recess-
88.
Recess her vitals.
Her capillary refill is 2 seconds.
Okay.
Her blood pressure is returned to normal.
Okay. So call the pediatrician, get expert consult,
Mhm.
maybe an x-ray of her chest.
So just to review, is there anything we could have done? What do you think we did good, first of all?
We did the
Assessment was fine.
Yes.
Rapid interpretation. It's just making the distinguishing points of hypovolemic versus hypovolemic shock and compensated shock.
Right.
They're still going to get fluid boluses, but it's recognizing those.
Compensated to the hypovolemic shock.
Yeah.
Okay. Okay.
Okay, so that's good. Our last one, if you'll get out your algorithms, is going to be for VTAC pulseless. So we're going to put this kid in at 30 kilos,
Okay.
so a little bit larger.
Okay.
So that's green on the Broslow.
Okay.
This kid was playing sports at school. Was struck in the chest with a baseball. Came home with mild bruising. He just tells his mom he has chest pain. She brings him in. He seems to be in distress of some sort, complaining of chest pain, and you see a centralized ecchymosis on the chest.
Okay. Okay.
He's alert and talking, but his sats are a little low.
Okay, so we'll get him on monitor, put him on O2
It
pulse.
really hurts here. It really
Okay.
hurts.
Ask him his pain scale.
So
1
we
to
show him
10,
smiling faces or
smiling
sad faces, but
Consider
he's kind of in the middle of
analgesics.
a frown to pain.
Okay, we consider analgesics for pain.
Yeah. And then, so what are you thinking if he had trauma to the chest? So he got hit with a baseball.
Probably like, maybe like a pneumothorax.
Could be.
Maybe.
So we're gonna put him on the monitor,
Okay.
and let's just say underlying rhythm is sinus,
Okay.
and there's some PACs, and now you're starting to notice more.
Okay. So like a heart block.
Well, what are these here?
Those are white
Yeah.
QRS complexes.
So where's that ectopy coming from?
The ventricles.
Yeah. So they're PVCs.
Mm-hmm.
So let's roll the rhythm. Start the IV. Expert consultation. Let's get an EKG on this.
EKG. Okay.
And so we run the EKG, and we see that there's coupled PVCs on it. They're they're unifocal, but a kid doesn't usually have PVCs. So he's had trauma to his chest.
Alright.
So I'm thinking, this is kind of off the beat, but chest trauma, like the football guy, it's called commotio cordis.
Mm-hmm.
So if they get hit on the chest, you can knock the heart out of rhythm.
Alright.
We're waiting for the cardiologist to come in and assess him. He loses consciousness and goes into this rhythm.
Okay.
What's the rhythm?
So the rhythm is ventricular tachycardia.
Continue.
Is he awake and is he
No,
alert?
unconscious.
He's unconscious. So we got him on the pads.
He has no pulse.
No pulse.
So
and
while you get
no
the
good
pads on,
chest
what
rate.
should I be doing?
Immediate compressions.
Pads are here, but we're not using the AED for this.
Okay, so the pads are on.
So go ahead and put them
Just
on.
put 'em on. Okay.
If they're adult pads, you can use them, just
Okay.
anterior and posterior.
Okay.
Anterior. The one's on the back, so I'm gonna start CPR. So how much are you supposed to shock him on initially?
So the little kiddo, we are going to do 2 joules per kilo,
So he's 30 kilos, so that would be
60.
yeah. So set me at 60. It may not set at 60, so you have to go with the number higher. So take that.
Okay, I'm gonna charge. Okay, ready to shock, everybody clear?
Clear. It still hasn't
Okay,
shocked yet.
continue
It still hasn't
CPR.
shocked.
Okay, hasn't shocked yet? Okay, ready to shock, everybody clear?
There you go. I'm getting tired.
Okay, so we'll switch.
Call out your team.
Okay, Amy, go ahead and switch with Anthony and compressions.
Okay, I'm Amy now.
Okay, so we got the crash cart, we got Joel doing charting, Julie would do meds.
And your team navigating. So
Okay,
can you monitor CPR? Sure. So
okay, we're at a 2-minute marker on CPR,
no change.
no change, okay.
So we go from what's our joules now?
Okay, so our joules is 4 joules per kilo, so that was, you said 30, right? 30 and 4, so that's 120. Okay, I'm gonna charge. Okay, everybody clear?
Clear.
Shock.
I'm tired.
Okay, we'll switch.
I can't get a peripheral line in, so what is our
Okay,
next?
we're gonna do an IO.
Iowa's in the left tibia.
Left tibia
It's
Okay.
patent.
is pained. So we could, this is pulses, we can administer epinephrine at 0.01 milligrams per kilo.
Okay, that's fine.
Okay,
2 minutes later.
2
Any
minutes.
change?
No change, so I'm going to go from subsequent shock at 4 joules per kilo.
And we're at that right now, so
Okay,
we're
so I'm
good.
gonna charge. Everybody clear, clear,
Clear.
charge.
Resuming CPR has been
Resuming CPR.
intubated, but I'm only getting breath sounds on this side.
Okay, so we're gonna do breast,
The tube is gone. I'm only getting breath sounds, where's the tube?
if we're only getting breast sounds, we're probably
On the right.
on the brachial branch.
Yeah,
So
so
we're gonna deflate the cup and pull out the tube.
symmetrically, so can we start compressing asynchronous? He hasn't had any antiarrhythmics,
Okay, synchronize. Okay, so I'm gonna sync,
but he has a pulse.
but he has a pulse. Okay, Okay, so now we have a pulse, so we're gonna.
No, he has no
He
pulse.
has no pulse, so, so we're gonna charge again.
Mm-hmm.
There we go, charge. Everybody clear?
Clear.
Shock.
I'm tired.
Okay, 2 minutes up. We'll
So we gave
switch.
Epi and shock. Anything
Epi
else?
and shock. We can go into amiodarone or lidocaine. Amiodarone 5 milligrams per kilo is 30, so that would
150.
be 150.
So it actually, if you're looking at amiodarone, where it's at, they're continuing CPR. Ketamide.
Probably this one. Amiodarone.
So if he's getting 150, that would be 3
3
mils, so he
mils.
gets the whole box.
Oh, look at that. Okay.
So gave the amiodarone,
Okay, compression.
no change.
No change. I'll continue to charge.
Okay.
Compressions. Everybody clear? Clear. Shock. Okay.
And this is a
continue.
touch screen, but it's kind of hard to.
We'll continue CPR.
Yeah.
We'll continue CPR.
He's intubated. He's waking up and
Okay.
trying to pull out his ET2.
Okay, and we got somebody says vital signs. We may probably give some
Glucose seems normal.
glucose. Okay,
He's
glucose
normal.
is normal.
He
We
pulled
can
out his
just,
ET2. And he's
okay.
breathing on his own, so
Okay,
come on.
some supplemental oxygen.
So based on he's looking at you pulling out his ET2, does he need
He's
he
now.
need hypothermia protocol?
No.
Okay. Very good.
Okay.
Anything in this you could have done better, or what was good? What was your level of comfort?
Well, I think it's the joules and calculating to increase by the kilos and increments of a 2 to 4. I think just overall getting the glucose, getting him a monitor, getting him on oxygen, reassessing.
So that's good. And then just remember that the VTAC was pulseless.
Okay.
So if it's pulseless, there's no need to synchronize. Synchronize only comes in for a tachycardia, narrow, wide, unstable.
Okay.
Very good. So this concludes all our skills check off. Excellent job. I'm Anthony Pino, and this is Davina.
Davina, thank you.